So this morning we're going to look at the language that I use to describe how the body moves. And so again, this is going to be a bit about anatomy. Your muscles connect your bones together. So if I look at my arm bone, or my arm bones, and the muscles of my arm, I have a muscle that runs from the upper arm to the lower arm, and it crosses over those bones to form the elbow joint. Let's call that the bicep. Now, muscles contract, so the muscle fibers shorten, and because the muscle is attached to the bone via a tendon, when it contracts, it pulls the lower arm bones towards the upper arm bones. Whenever two lots of bones move closer together and decrease the angle between the bones, so at the elbow joint here, we call that flexion. So when bones move together because the muscle contracts across a joint, that is flexion of a joint. And the opposite is true when two bones move away from each other. So this contraction of the tricep at the back of my arm, that's actually lengthening now, so muscles work in pairs. So when one set of muscles contracts, the muscles on the opposite side will stretch. So when I contract the tricep now, it pulls the lower arm bone away from the upper arm bone and opens the joint. So it increases the angle between these bones. And that increase is called extension. So we have a flexion of a joint. We could see that in the hip joint. So my psoas muscle contracts to pull the femur, the thigh bone, closer towards the hip point. That's hip flexion. If I contract my buttock and move my hip bone and my femur away from each other, that's hip extension. Alright. Flexion and extension for hip, flexion and extension of the elbow. So that's just two types of movement. They're the very basic ones, and a lot of our joints do flex and extend. We also have a range of movement called internal and external rotation. So you could see that in the top of the arm bone. I can internally rotate my arm, and that pulls my shoulder forward as I turn my palm back, and that's going right up into the top of my shoulder joint. So internal rotation of the shoulder or the arm, and then the opposite of that, turning my hand back, but as I continue, that movement can go all the way up to the top of the arm bone, and that's external rotation of the arm. Internal, external, internal, external. Again, that can happen in the hips, internal extension, rotation of the femur into the hip joint, external rotation of the femur into the hip joint. I like external rotation of the arms. Generally, that just helps to draw our shoulders in, down and back, and posturally that's a good arrangement for your scapula, your shoulder blades, and the position of your arm. We tend to, in life, become a little bit rounded shoulders, slightly internally rotated in the arms. The front of your hands are facing forward, thumbs are turned inwards, and we seem to kind of move around a lot in that position, which makes our backs a bit rounded, chests a bit compressed and tight. So yeah, just in a general way, externally rotating in the arm a bit more, it doesn't have to be dramatic, can just help to give you more openness for your breathing up here and with alignment of your shoulders and scapula. We have a midline in the body, and when bones move towards that midline or across that midline, that is adduction. We're adding across. And when bones move away from the midline, that's abduction. Adduction and abduction. Some people call that lateral and medial. So if we move laterally, we move away. If we move across, we move medially. Alright, so we also have, so that again can be seen in the hips, so I can move my femur towards my midline, that's adduction, away is abduction, adduction and abduction of the hips. We have ranges of movement in the scapula that are quite specific to the scapula, so the shoulder blades in the back. When we lift the shoulders up towards the ears, it's an elevation of the scapula. And when if I reach my hands down and I pull the tip of my shoulder blade down my back, that's depression of the scapula, elevation, depression. We have protraction and retraction. So when, again, if we think about the midline and we think about, still coronavirus, coughy, horrible voice going on, I'm really desperately keen to get rid of this sound in my voice and this croakiness. Do apologise. So protraction and retraction, this can happen in the scapula, so when we pull the shoulder blades together, that's protraction, and when we pull the shoulder blades apart, so we're thinking about the back of the body, that's retraction. Protract, so retract, pulling together, protract, pulling apart. And the head does that as well. We tend to be in forward head posture. I'm going to do a whole tutorial on forward head posture at some point, but we tend to be protracted in the head. The chin juts forward, the back of the neck tightens, the postural muscles of the neck lengthen and become weak, and we get a bit stuck like this, and it's causes a huge amount of tension, headaches, and it's just very bad posture. So retraction of the head, drawing the back of the head back, tilting the chin ever so slightly downwards to lengthen through the back of the neck, allows the SCM, sternocleidomastoid muscles in the front of the neck here, these big ropey ones, to do the job that they're meant to do, which is to hold up the weight of the head. So you should see those engage, contract, when you retract the head. So elevation, depression, retraction, protraction, and circumduction of the shoulder joints, so going back to the top of the arm bone. We've got some circumduction joints here. These go round and round in the socket. Quite a lot of our joints have this ability to rotate in the socket. These movements can be quite complex. So at the moment I've got my palms down. I could do the same movement with my palms up, backwards and forwards. I can do it with my palms facing forward, and I could try to do it with my palms facing back. There's a whole range of various movements that you can combine together to create variable movement in the body. And we do look for variable movement in the body. We try in yoga to increase the ranges of movement throughout the body away from our normal modes, and therefore we keep the whole of the musculoskeletal system limbered, flexible, and the joints can be mobile. So also talking about the top of the arm bone, we have internal and external rotation, and that can be combined with elevation as we move up. This should feel quite tiring after a while. We don't want to get the neck muscles, shoulder muscles too tense as we do this. And if you also then protracted the shoulder blades by taking the arms forward, you could also internally and externally rotate the top of the arm bone, moving down and forward. So we looked at flexion and extension of the hip. We've also got circumduction of the hip. You can hang onto a wall to do these circumduction exercises, and you can do them in a clockwise and anti-clockwise direction. And that's circumduction of the hip joint. And so when we look at the spine, contrary to what our intuition tells us, when we make this rounded movement of the spine, we're actually bringing the bones of the spine closer together. So I'm actually going to stop this video here, and then we'll do a very specific one on the spine, and we'll use the anatomical model. So watch out for that. And we'll do a separate tutorial on the hands and feet because they take quite a long time. But that's just a general run through of the terminology mostly that I use when I teach. So I'd like you to become familiar with those terms so that when I say internally rotate your arm, you'll know what to do. Or if I say externally rotate your right hip joint, you'll know what to do. And that type of language is scientific, and it should apply throughout all types of body movement exercise, whatever sort of awareness you have or whatever classes you do. Those terms are transferable to all types of exercise and body movement. So quite a good thing to learn if you're not familiar with them now, to get a little bit more used to those descriptions so that you can apply it to life. All right, thanks for watching.